meeting early in the morning. And what I found is with our standing meetings that we have, it's just easier to kind of set a meeting for earlier in the day, and then we kind of find out, who is really committed to being here, from the gallery side. So I appreciate those of you who were not out so late last night. I'm not speaking about the senators, but the other people in the room that you were able to make it in today. But with that, we'll call the meeting to order. We've got 8 things on the agenda this morning. I believe you've got a little agenda in front of you there. The first item that we're going to bring up today is Senate Bill 2125 regarding health savings accounts. And I'm going to recognize Senator Barrett to explain that bill.
Thank you. Thank you, Mr. Chairman. This is a bill that's been authored by Senator Johnson. And ultimately what this does is it directs the state to facilitate a health savings account for employees to make contributions through their cafeteria plan. So it would be pre-taxed. As it stands, the state currently offers a flex plan in which an employee can make contributions. However, under that flex plan, you have to almost certainly know the cost of the monies that you're depositing, and any monies that you don't use are lost. With this health savings account that Senator Johnson has proposed, the money will roll over from year to year. This in no way mandates the state to pay anything. The state will not make any contributions for the employee, and contributions by the employee are optional. Ultimately, this will help people better prepare for all of their health care needs. That's a brief explanation of the bill. I yield for any questions.
And I'll just share too, to reiterate, there's no cost to the state on this. And the understanding from conversation Senator Johnson had with Stacy is that because they're already administering the cafeteria plan and some of our other plans, our statute already has provisions in there for a health savings account. They just have not been kind of led to go that direction on it. So this optional participation will be part of what we receive at the end of the year each year when people reach out to us and ask us what, if any, changes we might want to make in either our deferred comp or other plans like that. So Senator Williams, for a question.
Just simply put, it's just another tool in the toolbox.
That is correct.
It's optional. You don't have to take it. Nothing changes if you don't want it, but it's another feature for people, the HSA.
That's correct.
Thank you. Thank you, Mr. Chairman.
Any other questions from the committee? Seeing none, is there a motion?
Title sufficient, do pass.
It will actually be title sufficient, do pass, committee sub.
Yes.
All in favor, say aye.
Aye.
Any opposed? Okay, that bill will be reported. Next, we're honored to have Senator Hickman up early with us this morning. So welcome to 8:30 meetings. And we have Senate Bill 2244, which is a bill he is very passionate about regarding our foster care children and access. So I'm going to recognize Senator Hickman to explain his bill to us.
Thank you, Mr. Chairman. First of all, I want to say thank you for 2 reasons. One, being here this morning a little bit even ahead of time has showed me that I can do hard things. And number 2, thank you for allowing me the opportunity to present this bill. To not fall in the pitfall that I've heard so many times here, I will say this in the most lawyer terms I can. The intent and hopefully the language of this bill is a very simple bill. What it simply does is it allows foster children and foster families to be able to access our parks and museums for free, as well as access to their transcripts when they're in college. Most of you don't know, but I was a foster parent at one point, and I just know how difficult it is for those children when they're in the system. And even when they go back to their homes, they're typically going to some difficult situations where they're needing help. And I think this provides a little relief. It also says to our foster parents, like, hey, we want you to be able to do recreational things, because taking in extra children, even with the subsidies that come with it, it is a financial strain. And so it allows them to just have some type of enjoyment of life. I'll take any questions, but I hope you guys will support this simple effort. And I will say, to the credits of the chairman, he absolutely does his due diligence. He asked me to get a fiscal note. It's coming. We're still working on that. But this bill, just to let you know, is double referred. It'll have to go through appropriations after it leaves this committee. But I have heard from LBO, and they said the expenses to the state are absolutely a minimum.
Right, and I'll share too, because this may have been before you joined us in the legislature, but we had a bill a few years ago that basically discussed how few of our foster kids and people in CPS custody, how few of them go to college. And so I will say that on the provision for the transcript, unfortunately, I think that will be a pretty minimal number. But anything we can do that gets the kids out there, gets them into parks, gets them into museums, I think can maybe foster an ability to over time maybe see more of them get into higher learning and things like that, which is what I think we would all like to see. So, any other questions from the committee? Senator Hobson first.
Thank you, Mr. Chairman. I'm trying to figure out where Section 3 falls into this bill. Section 1 looks like it deals with the transcripts. Section 2 is the
Section
going to
2
the
is a state
parks.
park, and then Section
and Section
3 is
3
the
also
museum.
defines those museums. What is that part of the state parks portion?
Yeah, parks and museums, they separated them. So 2, I think, deals with parks and 3 deals with museums.
And there's no separate code section for Section 3. Is that correct?
I don't think so.
It doesn't reference one in the bill. I was wondering if that was left out or if that was part
So-
of the parks.
When I looked at it, my first thought on it was, because we're repeating definitions, and you and I have the same feeling about definitions.
Yeah.
Try to use them as little as we can. But my first thought was, could we just kind of combine all this and just reference all 3? And to your point, there were 2 code sections. I did not see the 3rd code section either. I don't think, I think we probably could have included them, maybe in just done 2 sections instead of 3. But this was how it came to us. And so we'll talk if we need to, but I'm comfortable with the language in this.
One other question, Mr. Chairman, if I may. How does it work with the foster care children? I mean, obviously this defines that they're eligible, but if you show up at a museum, is there a card or something that you would present, or do you have papers from CPS that you can show, well, look, this child is eligible to enter for free?
So CPS does give, I mean, there's paperwork they could present that we are a foster family and all that, but I mean, we could easily, I guess, promulgate something where they give them some type of a pass or what have you. I mean, we can think through that, but I would think that the paperwork that they have saying we're a foster family or whatever would, notify them that they are. And just to back to your further point, I'm always open if we get this through the process. I'm not married to the language or whatever. Any corrections or changes we need to make to fulfill the intent, I'm absolutely fine with that.
I just didn't want a child to show up that's a foster care child and have someone, say, well, how can you prove that they're a foster care child? And I really don't know the process, and just making sure we can streamline it as efficiently and easily for the museum and the park and the transcript. Transcript's probably different because I would assume they've got paperwork they're going to do that online primarily, but then the other 2, I don't want them to show up for a park thinking they're getting in for free. And then somebody say, well, how do I know you're a foster care child, and what paperwork do you have to have?
I think that's absolutely valid. And what I can do is just get with the department from the time that we, if this makes it through the process, from the time we get on the floor, offer some floor amendments that make that or clarify that.
Thank you, Mr. Chairman. Thank you.
That's an excellent point too. And, I would hesitate to ask us to have the department issue a card or an identifier kind of mark on this, because as children who move through the system are, sometimes moving from sometimes one family to another. It may be something where we then have CPS pushing back against us on this because of the administrative burden that they might see on this. So in your looking into it, I'd like to make it as simple as we can, but get the message out.
And I think we can just figure out something that they already issue or something that they already have that could be an identifier that we also let our parks and museums know that this works.
Senator Brandy?
Thank you, Mr. Chairman. My question was along those same lines. How will the museums know? And I'm totally supportive of this bill. I think it is great. My concern is that this one is working again. The youth court papers, as you know, are confidential. And so just, I think as we work through the process, let's look at maybe a simple method, but something that will not jeopardize any of that confidential information for these children.
Absolutely.
Thank you for your work.
Any other questions from the committee? Senator Turner, Ford?
Thank you, Mr. Chairman. Did you all consider in drafting the bill, maybe reducing the cost of the transcripts to maybe $1 as opposed to stating that they're free?
We didn't, but as I said, I'm just trying to give Foster some relief. If that's something you want to work on, get with me if there's a reason behind that. I think we can make that happen.
And the concern is the giving of a gift. And so that would be something that I would want to consider. Thank you.
Excellent points. Any other questions from the committee? Seeing none, is there a motion? A motion title sufficient do pass. All in favor, say aye. Any opposed? And this bill will be, of course, going on to appropriations. So I think it was great today to have our chairman in here to hear that and have his questions answered. So when you're speaking to the chairman about it, Senator Hickman, I think you have already kind of made your point a little bit, and it might save you a little less. Yeah. So, but we appreciate having you today. The next bill we're going to call up is Senate Bill 2300, which is a bill from Senator Hill. And just to give you a little background on this, so this concerns the Occupational License Review Commission. Many of you will recall several years ago, we set this up, and at the time there was a lot of debate. There was a lot of input because we basically are having all the rules and regulations for the occupational licensure boards go up to a triumvirate, which at this point includes the governor, the Secretary of State, and the Attorney General. During the last couple of years, I've had discussions and talks with particularly the Secretary of State about a particular provision that some states have taken some exception to. And that is the fact that the Attorney General has representatives on all of the occupational licensure boards, representing them. And there have been some states and maybe some opinions that have been opined that say that to have the Attorney General in that position, and then to also have the Attorney General issuing the opinion at the triumvirate level, is some degree of a conflict. I felt fairly strongly that I didn't think that was the case. I'm still not absolutely convinced that it's the case. This bill, as it was proposed, was to move the lieutenant governor and the department and the insurance commissioner to the commission as the reviewers. When we set the bill up, there was a lot of discussion, though, about we wanted to keep the triumvirate level decision makers at the executive level branch of government, which in my opinion is governor, lieutenant governor, AG, and Secretary of State. So this proposed amendment here tries to satisfy that. This is still a work in progress as we kind of discuss things, but the only change that it does here is it moves the Attorney General off of the triumvirate and replaces the representative to be the lieutenant governor. So all four will basically be there. It's just the AG will be there in that capacity to represent the occupational licensure boards as counsel. And as you know, from the dental examiners versus the teeth whiteners Supreme Court case in North Carolina, this whole need for this legislation came from that Supreme Court case because the AG has the prosecutorial ability for the licensure boards because the licensure board cannot prosecute people outside of their sphere. So that's a long explanation to give you some background on it. The other changes here is that the bill, as we originally introduced it, said that meetings would be called only by the chair. This makes a change that says that other meetings can be called by a majority vote. So if two of the three wanted to meet, and call a meeting, they could call that instead of it having to be the chair. And same thing on record request in lines 23, any member of the commission. So in this scenario, Lieutenant Governor, Secretary of State, or governor's staff could request the data. And then on the last part of it here in line 52 through 54 says all proposed submissions to the commission shall be acted on by the commission according to this chapter within 150 calendar days of submission. The bill as proposed had 120 days. 120 days I didn't feel was quite enough. I think 150 days gives you 5 months. And if they're meeting quarterly anyway, I think they should probably be able to act within that time. But we're trying to make sure that any of the regulations that come down or go up from the licensure boards are dealt with in a timely manner. So that's a long explanation of a difficult topic. I'll yield for any questions from the committee. Seeing none, is there a motion? Motion of title sufficient do pass. All in favor, say aye. Committee sub, thank you. Thank you, Senator. Title sufficient do pass, committee sub. All in favor, say aye. Any opposed? Okay, that bill will be reported. The next bill on our agenda is Senate Bill 2302. This bill, kind of similar in the reporting types of things, more of a transparency bill. Basically, in lines 10 through 12 in existing statute, it says that an agency shall cause notice of its contemplated action to be properly filed with the Secretary of State for publication in the administrative bulletin. What this bill would do is in lines 27 through 30, it would also require a copy of the notice contemplated to be emailed to all members of the legislature, basically at the same time by the Secretary of State. So any agency changes and rules and things like that are already reported by the Secretary of State through a bulletin that I'm not sure I've ever seen. Some of you may check that and may be aware of it, but I don't remember seeing any of those. I think this would be just a good way where we could get information to the legislature about what's going on as far as administrative changes in the agencies and get more transparency on decisions they might be making. So yield for any questions. Senator Hobson.
Thank you, Mr. Chairman. Do you know if we get the rules of all the agencies and boards? I mean, are those available? Do they post those online? Because if I receive a proposed rule change out of context, I'm going to have no idea what it means or how it affects anything else that they're doing. And I've got enough mail coming to me right now that I'm not sure I want more coming where I don't understand the purpose of what's being done.
I would prefer to your point, and this is a conversation I continue to have with the Secretary of State on this, is even if we got some compilation, of those changes that came on a periodic basis that came to us, and instead of maybe every rule change coming like that, might be better. So I've asked, his office, of the burden this would be putting on them. And, as we went through in the last meeting, additional education and thought is going into this concept. And so I don't want to put a reverse repealer in it because I'm hoping if we need to make some change, it's a fairly straightforward concept. But if we could pare it down where we're not getting, I certainly am with you. I don't want another 500 emails. If it ends up being changes that occur very infrequently, and there are only, half a dozen or so that we might get during the year, then I think that would be fine. But if it ends up being, several hundred of them, I'd rather maybe put a provision in there that we should be emailed monthly or something like that, to once I get the numbers on it, which I do not have yet.
Well, I agree with you on that. I think if we got a proposed rules change, if I don't have access to the rules of that agency or that commission, it's going to do me no good because it may look squirrely to me, but if I read all of it, which you'd have to have a lot of time on your hands to go read all the rules of every agency in the state, every board or commission, then I might understand there's another provision that makes it not so squirrely to me.
Right.
And I don't know if this is, seems like the agency ought to be able, it's not like I'm totally opposed to it, but it just seems like it's going to be a lot of information without a full understanding of what that commission or agency or board is doing. So a little bit concerned about that.
Right. And I'll continue to speak to other senators about it too. I know I've had a few come to me who have the opposite concern about that on certain things that they feel like they have not gotten notice of. And so there's probably going to be a pendulum of, kind of positives and negatives to this. And so that's why I want to kind of pare it down a little bit more and get a little more information on the numbers, and that kind of thing. So I will have that before I bring it up on the floor, to answer any questions.
Thank you,
you
Mr.
have.
Chairman.
Thanks, Mr. Chairman. Any other questions on this bill? Is there a motion? Motion of title sufficient do pass. All in favor say aye. Any opposed? And that bill will be reported and we'll continue to look into that. The next bill is Senate Bill 2406 concerning Public Records Act. This comes to us from Senator England and Senator Barrett, and I'm going to recognize Senator Barrett to explain the bill.
Thank you, Mr. Chairman. But before I start explaining this, I would like to say, obviously, I think everyone in this room knows that this administration and this body is certainly for transparency, and nothing in this bill suggests anything other than that. Having said that, because law enforcement is such a stressful and tenuous job, Senator England and myself have proposed this bill in which the home address, any telephone number of a privately paid account, so obviously state phones would not be included in that. So the home address, privately paid accounts of telephone numbers, or other private information from law enforcement officers, criminal investigators, judges, or district attorneys, their children or their spouses would be exempt from the Mississippi Public Records Act. Again, this in no way is an attempt to get around transparency or usurp the Mississippi Public Records Act. What it is an attempt to do is keep private life private and public life public. In order to do so, if you'll turn over to page 2, upon an online or written request of a law enforcement officer, criminal investigator, judge, or district attorney, the spouse or child thereof, there would be a written request of that in a circuit clerk's office or a city clerk's office. In reading this bill, I did not find in the language for that office, which is provided, but certainly in a governmental office, that law enforcement officer, investigator, judge, or DA could make application, and their private information would be redacted. This would not apply to any kind of sworn statement under oath given in court. It wouldn't apply to court transcripts. And again, I think the motive behind this is to protect private individuals. Just this session, and obviously legislators are not included, but just this session, I have found my private home address on the internet in a comment made on Facebook, as well as cell phone numbers, my daughter's cell phone numbers. And again, while legislators are not included on this, this is certainly just an attempt to protect the private lives, private information from law enforcement officers and the other occupations which are included. Again, I think we all know that this administration is for transparency. Having said that, I will yield for any questions about the bill.
Questions from the committee? Seeing none, is there a motion? Senator Turner forward.
Thank you, Mr. Chairman. And I understand Senator Barrett's points about private information being posted online, but this restriction is being imposed upon governmental agencies, correct, in the production of public records.
I don't think of it as a restriction. I think of it as an exemption. But are you asking if local law enforcement agencies would be in charge of redacting information? Is that the question? Like putting more of a burden on them?
No, it's more of a concern. Are law enforcement agencies or government agencies releasing this information?
Well, I think it was readily available online.
And so I guess my question is, does this bill address the situation that you just described to us? Because as I understand the Public Records Act and the exclusions and exemptions
Mhm.
that apply, they apply to governmental agencies. And
Correct.
so if a chancery clerk, a sheriff, police receives a request, then they're supposed to provide information within the confines of the Public Records Act. But I don't
Correct.
think that's going to affect my home address being out online if it was not provided by a governmental agency.
Sure, yeah, I think I understand. Your question is saying, is this necessary because why would it be available already by the agency?
I guess my concern is, are agencies and are agencies, law enforcement officers, et cetera, are they releasing this information to the public?
In speaking to Senator England, yes, they have been.
Thank you.
Yes, yes, ma'am.
Good questions. Any other questions from the committee? Seeing none, is there a motion? We have motion title sufficient to pass. All in favor, say aye. Any opposed? Yeah, that bill will be reported. The next bill on our agenda for today is Senate Bill 2713, Regional Health Authorities. For those of you who are on public health or who went through the committee presentations as we've kind of started this year, many of you got to hear the presentation of Dick Cowart earlier in the session. The Department of Health, along with the Delta Council, engaged Mr. Cowart and associated firms to make an assessment of the healthcare within the Delta region. They found the following: the 18 counties of the Delta are characterized with high levels of poverty and regional mortality rates that have increased while national rates have decreased. In late 2022, multiple hospitals were struggling to meet payroll and stay open. The Delta counties have worse outcomes than the rest of Mississippi, and the problem is continuing. The Delta has a chronic healthcare work shortage. Mr. Cowart and his team interviewed the leadership of multiple Delta hospitals, including Greenwood LaFleur, Delta Medical Center in Greenville, South Sunflower Medical Center, Northwest Mississippi Regional Medical Center, North Sunflower Regional Medical Center, Delta Health Centers in Mount Bayou. Essential needs that cannot be met included maternity care, specialty care, and emergency services. As a result of those conversations and the work of Mr. Cowart and his team, he came back with some recommendations that many of you heard in the hearing earlier. The recommendations were that a public solution to achieve a regional approach be considered like has been used in Tennessee and Alabama. He suggested legislation to enact a regional health authority construct with two phases. Phase one is an organizational board. Phase two is a voluntary board, voluntary joining of the board by hospitals to achieve collaboration and shared resources and benefits. Target areas of excellence include women's care, cardiology, endoscopy, general surgery, and urology, along with pooling of items such as electronic health records. So with that collaborative kind of vision in mind, with the help, as always, of our great staff and team here for the Lieutenant Governor, one of which is in the room here, we have this proposed language. And I'll share this before I go into this. I had great meetings yesterday with several senators from the Delta. I know at the last meeting, there was some concern that the committee had not reached out to people ahead of time. So I did my due diligence yesterday. I met with 5 senators from the Delta region and kind of ran through this and kind of explained to them, what our thought is on this and where we would like to go. And so with that, what we have here is the Mississippi Rural Regional Health Authority Act. The intent of it is to maintain health services, attain financial sustainability, achieve economies of scale and skill, and identify skilled affiliation partners within the region. Section 3 of the bill is just definitions. It includes the 18 Mississippi Delta counties, which I will go ahead and read: Bolivar, Carroll, Coahoma, Grenada, Holmes, Humphreys, LaFleur, Panola, Quitman, Sharkey, Issaquena, Sunflower, Tallahatchie, Tate, Tunica, Warren, Washington, and Yazoo. Section 4 is the establishment clause. It creates a regional health authority. Section 5 creates an organizational board. So again, I've said there are two phases. The organizational board will be the initial 5 members of the board. That will include 5 appointments, 3 from the governor, 2 from the lieutenant governor. Of those, 2 from the governor will be legal residents of the Delta, and 1 of the 2 from the lieutenant governor shall be a legal resident of the Delta. The appointees must be diverse. Once this organizational board gets rolling, then the organizational board will kind of flow in here. The organizational board then will add an additional 6 members as affiliates come on board. So if you can picture it like this, if a hospital chooses to join this voluntary agreement, the hospital through a particular participation agreement will establish that they want to be part of this. They want to use this networking, communicate this collaboration for shared expenses and things like that. And they will establish a member to move on to the board. Over time, this board is limited to 11, but if we have more partners who come into the process, we may amend that in the future. But this will be a phased in approach where the board grows as the necessary partners decide if they want to join this method or not. The members of the board will serve 4 years with a maximum of 2 terms without pay. I mentioned the participation agreements. Each participation agreement with owners of the community hospitals will establish the powers and duties delegated by the community hospital to the authority. Participation agreements will include the regional authority, governing board of the community hospital, and the board of trustees in the community hospital. The community hospital board, should they choose to enter into this, will not be governed by the community hospital statutes anymore, but will be governed by this act. The board of trustees for community hospitals, which is overseen by the regional authority, shall include 5 members designated in the participation agreement. So the community hospital will still have a board. They will just be, as part of the participation agreement, a separate board that's not part of this regional authority board. Licensures shall remain, and the existing licenses will kind of follow through at Section 8. Section 9 establishes a CEO who will be empowered to do the typical things that a CEO of a corporation would do. Section 10 just gives the authority the ability to assume the powers needed to contract, borrow funds, and to budget. Section 11 basically gives the authority the ability to develop a strategic plan. And then the key to all of this, and one of the reasons, I think the biggest reason to consider this, is Section 18. Section 18 is Medicaid supplemental pool, which is new language. So this would create a supplemental payment program in order to allow the authority to pull down federal funds through Medicaid. So in general, this mode of restructuring is all about the money. It's all about trying to find creative ways to get money to the Delta hospitals in a manner that we have been unsuccessful as a state to do. If we are successful in this endeavor, the hope would be that not only would the hospitals have an ability to come out of this crisis they've been in a better shape, but also there are statistics out there that say that when healthcare is not prevalent in an area, people don't want to live there. And so that was some of the detailed talk that I had with some of my Senate colleagues yesterday, is that if we can do things for these hospitals in a creative way, maybe we can find a way to keep more people in the Delta. And maybe at the next census, we won't see that portion of our community, of our state, is declining in population while other areas increase in population. And I'll just close with a little quote from Dr. Edney from the presentation that we had in the informational meeting. Dr. Edney, from Department of Health, said the only option that cannot be on the table is to do nothing. I have spent time since I've been looking into this in trying to find other avenues of doing something, and I haven't found anything. I know our chair of appropriations has already started looking into this as far as what we can do kind of financially to help hopefully kind of draw down more funds and, make a difference for this community. I look forward to continued talks with him on this concept. But I know this is new concept. It seems like this type of issue is one that tends to kind of migrate to me pretty often. But I think with some of my healthcare background and other things like that, I certainly have a need and a desire to try to strengthen those communities in the Delta. So a long explanation. I'll open up for any questions from the committee. Senator Blunt.
Thank you, Mr. Chairman. I'm unclear as to what this bill, were it to become law, will allow the authority to do that these hospitals cannot do themselves right now.
Yeah, so what they would do, and I'll just give you one example, through collaboration, I've learned that all of these hospitals, for example, have separate electronic health records or electronic medical records. They would be able, as a pool, to seek a vendor to provide that type of service to all of the hospitals, get them all on the same page as far as how they communicate information, and decrease their expense that they're putting out. I spend thousands of dollars every month in IT and electronic health record payments. It's nauseating, the expense of it, and I'm just a single practice with a few locations, but hospitals on economies of scale have conditions and bills that are much, much higher because of that. The other thing that it does, and this came out of that meeting, is that, a lot of times we have community hospitals basically being forced to compete against each other. It's hard to get physicians and staffing into community hospitals. And if they were working as a team, and this is what's happened in other states, we might see where one of these hospitals decides through their collaborative agreement to specialize more in women's care. One might specialize more in cardiology. One might specialize more in endoscopy or, colonoscopies and things like that. And then as them working as a team, each of those hospitals would not have to each try to get a cardiologist or each try to get, a GI doctor. You could maybe spread that around. The community, I think, would learn, okay, when we need this specialized care in the community, where can we go for that, which could share expense, but also in discussions I've had with William Carey and with UMMC through our residency programs that we've tried to put up, I would like to see those institutions feeding doctors in there who can move in there, do their residency there, gain some connection to the community, and then hopefully have a desire to want to stay in that community. So those are just two examples of how that can happen. Will it for sure happen? I don't know, but back to Dr. Edney's question on it, this is an opportunity to bring this forward. I've also had conversations with the chair on the other end of the chambers as actually this morning. Their intent is also to move this forward. So it's an idea that's being considered by both ends of the Capitol, and look forward to getting you more information as it becomes available.
It certainly makes sense to me that they could collaborate on electronic medical records and specialties. But again, my question is, are they prohibited under current law from doing that?
I believe that it's either federal law or state law. There's some obstacles for sure for that. I'll have to get with you on the legalities. I can just tell you it's not taking place. It's not taking place anywhere in Mississippi. And so this would be somewhat of kind of a pilot for Mississippi. We considered in looking at this, giving the ability for this to be expanded to other regions of the state. And I took that out of the bill because I think that we need to prove that this is a positive before we expand that to other areas. I know Southwest Mississippi is potentially going to maybe have a similar need in the future. But if this works, I think we'll learn something about it. Again, I don't think there's any danger to the hospitals to consider doing this. I think some of them may decide to do it, some may not. And certainly there are far better experts on their teams who can maybe see the advantage of this. And that's what I like too about Dick Cowart's work on this, is that this is not information that's coming from me as chair of AET. this is coming from the work of the Delta Council engaged Mr. Cowart and his firm. Mr. Cowart lived in Mississippi for 42 years. He's now in Nashville. He has a large firm of multiple attorneys that do this type of work, and this is his recommendation. Oh, and the last thing I get from council here is that is the money. You know, is by setting this up in a unique fashion, the intent of myself and the legislature is to creatively try to get this struggling area of the state more money, you know, in any way we can, and also allow them to seek grants and other applications to try to achieve that need. Senator Turner Ford.
Thank you, Mr. Chairman. I know very little about community hospitals. I'll say that up front. Looking at section 10, starting at line 339.
I'm going to have a little different line numbers than you
Okay.
because of some changes I made late last night.
It's-
If
So
you
I'll
kind of
just,
point me to the subsection, if you would, within
I
10,
will.
if you don't mind.
it's subsection 10, section 10, and then it's subsections A, B, C,
Okay.
and D, which refers to the authority not having to require ratification or approval by the owner for the contract of purchase of real property. So who owns the property? And then would this authority have the authorization to just, there's no negotiation required if real property is to be purchased? And is that what this basically
So-
means?
So through their agreement process, the individual hospitals will, through their agreement process, set up their agreement of what abilities and things they want to designate to the regional hospital kind of unit. And through this, you know, I could see that they could collaboratively, the members of the group, they could decide that, okay, in Issaquena, for example, we as a regional authority also want to put in a small, you know, emergency clinic or something to that fashion, you know, and so they as a group would be deciding the needs of the regional authority, you know, and go out and kind of seek solutions and things like that on behalf of the authority working together.
And so does the bill contemplate property being owned by some entity that the regional authority can take over or purchase without a negotiation process?
No,
I really do not understand what this.
yeah, everything in here
I
is,
believe the word owner refers to the Community Hospital Board of Trustees. The word owner is used throughout the community.
I'm gonna let
hospital.
council answer that question.
I stand corrected, but I think the word owner refers to the Community Hospital Board of Trustees. Throughout the community hospital licensure law, Sam, if I'm right about that, the word owner is board, the local board of the individual hospital. So this phrase right here that you're looking at, it's a good question, is saying that the authority board doesn't have to do the same, doesn't have to do an annual budget on its own. It works with the community hospital board. I think that's the intent.
And regarding the contracting of purchasing property, what can the authority do?
So also.
What would the
just-
authority be able to do?
I just heard from council also that, you know, according to Mr. Cowart, in most situations like this, in the agreement, most of the property is a lease type of arrangement. You know, it's not a purchase type of arrangement. But that's something that I will, you know, have to get a few more details on as this goes along. And, you know, back to my thing I say about this committee, AET, additional education and thought, and there are always people in this room who are making notes of those things. And, you know, I hope to have that, you know, certainly answered for you completely, because that would be a point that I would want to know as well.
Thank
you. Thank you, Senator. Senator Blackwell.
Thank you, Mr. Chairman. Did you, I like what you're trying to do here, but did you have any conversation with Medicaid?
I have not yet. My conversations have been strictly with Mr. Cowart and his group so far.
All right, and does this waive any certificate of need?
So there is
requirements?
there's a provision back here that it does not, but it's somewhere in, let me find my notes on it here. We did have a reference to that in the, in section 8, it allows the community hospital to retain and maintain their existing licenses and certificate of needs. So it's just a retention mechanism.
Thank you.
Thank you, Mr. Chairman. I look forward to talking to you more about this as this bill moves along, you know, because you are certainly a key component to this working and for us to getting those resources to the area. And so I look forward to your work on this as well.
700 clarify the change of ownership. This bill is not, is exempt from CON.
Right. And that's in section 8. Is that? Yeah, I think that's where. Okay. Yeah, it does have that exemption. Senator Hobson for a question.
Thank you, Mr. Chairman. As it relates to Senator Turner Ford's questions, I do think that needs to be ironed out. I believe that the actual fiscal plan, I believe that the hospital itself, the structure that you have in place is going to be owned by the county or the city. And this is only public hospitals, community hospitals, correct, under the definitions we have in the code, and that
Right.
the operation of the hospital, their day-to-day operations is going to be done by the board of trustees. But so we need to look into that, make sure, because I can see a situation where the regional health authority says we want to add or delete, and that may have effect on the county ownership, unless the county ownership is transferring that by way of lease to the.
And I believe that's
Regional
what it
Health
is. And
Authority.
so when we were speaking about this yesterday, you know, had the questions about the involvement of the county supervisors and kind of their role, I think is going to take place majority wise in the negotiation of the participation agreement. And so I certainly I share your concern on that as well, but I do think the lease provision is what's going to make them more comfortable with that. But I will continue to get more information on that before this comes to the floor.
Thank you. As in section 6, it talks about the key elements being established by the owner and the board of trustees of the community hospital. And so I guess I'm imagining something else we need to, you know, tease out a little bit more is will this have to be a decision between the regional health authority, the board of trustees of the community hospital, and the owner of that hospital, the county or city? County, I would assume most of these. All three of those have to come together. I think originally when I had discussed this at the meeting they had when they were here, was one or the other, the county or the county board of trustees. You know, as far as operations go, it makes sense that the board of trustees of the hospital will be the one to decide that. But if all three have to get involved, I guess we just need to know that and how that's going to work. And let me go back to one other thing on the, you know, this bill is set up as a rural regional health authority, I think is what it's referred to. And there's a definition here about rural regional and including but not limited to the Delta Regional Health Authority. So I'm assuming we're setting up a framework. And it's voluntary, right? All this is voluntary. Nobody has to enter into this.
Nobody
right?
has to enter into.
But we're then creating a separate, specific Delta Regional Health Authority that's only applies to them in those basically section 4
The 18 counties.
following, right?
Right.
Okay. I just want to be clear because I think there'll be a lot of questions in other places, like
And that's-
you know, is this rural?
Yeah.
Does this mean anybody else can do it? But right now, there's no mechanism in place for anybody else to do it unless we come back and create another regional health authority. Would that be correct?
That was in the proposed language that I had removed actually yesterday, was to give that ability for other areas to do this, you know, throughout the state. And I just didn't think that we were ready for that. Yeah, I think we want to put our concentration on the area of greatest need. And I think that's what this product does.
Okay, thank you, Mr. Chairman.
Thank you, Mr. Chairman. Great discussion on a very important bill and a very important need of the state. So seeing no further questions, is there a motion?
Title sufficient to pass committee substitute.
We have a motion. All in favor, say aye. Any opposed? Yeah, that bill will be reported. And then the last two bills on our agenda, I'll name the bills here and then I'm gonna make a motion. Our Senate Bill 2770 and SCR 527. My motion is going to be to take these up in block. The reasoning for that is you have to have both to move this initiative forward. The discussion of both bills kind of overlap, and so I'd like to explain both together and then, make a motion at the end to pass them both. So, okay, so the motion is take them up in block. All in favor, say aye.
Aye.
Any opposed? Okay, so we'll move to Senate Bill 2770 first. This is more of the statutory provisions of the ballot initiative. There's no one in this room who's not familiar with this issue, and so I won't go through the entire history on it. I'll just say that because this is now something that I've spent the last couple of months looking into in detail, I've learned more about it than ever knew I would, and learned what other states do. I learned what our state does. And so this is a proposal that comes from that study. There were several bills that were introduced by multiple senators on our side. There's a House bill that's already passed that's come over that is, I think, very limited in the changes or in the implementation of a statutory change. And so I'm hoping that this will be some good background where we can go through and give this the careful consideration it needs. So in Senate Bill 2770, it basically sets up in lines 25, 26, a petition for legislation. So this will be a legislation or statutory type of initiative instead of being a constitutional type of change. In section 1, a new provision is that any initiative measure shall contain a single subject. There are vast majority of the states who have this type of process require a single subject instead of multiple subjects. And so that will be a new provision. There will be an affidavit that is that the sponsor shall be an elector of the state. I made comments when this was first brought to me that I felt strongly that anything we do on this should be initiated and should be the will of the people of Mississippi. I've tried to make provisions in here to make sure that that's going to be the case because quite frankly, I don't really care what people from other states think we're doing or want us to do. I think we as Mississippians should do what we want to do in our state. The initiative will also identify the source of the revenue for the initiative and where the funds will be taken away from. This is just like what we do in appropriations on the floor. If you have an amendment, you have to establish where it's coming from and where it will be taken from. The initiative measure shall not take money from the capital expense fund or the rainy day fund. LBO will prepare a fiscal analysis of the issue. Just like before, the petition has to be filed 90 days before the start of the legislative session. After transmission to the Attorney General in Section 4, the AG will just have the enforcement ability to provide that the initiative is indeed a single subject provision. Beyond that, the AG's recommendations are advisory only. If the petitioner does not accept the AG's recommendations, there on the ballot summary, it will be accompanied by a statement that this is not approved by the Attorney General. After that, it's filed to the Secretary of State. The Secretary of State can only make section number changes or designation changes. After transmission of the title, the AG formulates a concise statement to the Board of Election Commissioners and a summary of 75 words or less. The submission to the election commissioners is new type of statute, but their role in this is advisory only. After review, the AG sends a ballot title and summary to the Secretary of State. An affirmative vote shall be to make a change in the law. A negative vote shall be no change. There will also be on the ballot a 50-word fiscal analysis of the measure. And again, in our current situation right now, as far as fiscal analysis, The only time we do a fiscal analysis in our previous method was should the legislature propose an alternative measure. We're taking out that alternative measure section. That, in my mind, was somewhat complicated. It made it very difficult, I think, for many of us in this room to explain what was going on the ballot initiative. So the alternative measure provision it will not be there anymore. In section 9, it just says the form shall have a space at the top indicating if the petitioner is paid or if they are a volunteer. Section 10 requires the circulator to register with the Secretary of State and be legal resident and submit an affidavit under penalty of perjury. They'll have to let people know via badge if they're a volunteer or a paid circulator, and they may not receive a fee based on the number of signatures that they collect. The initiative then is certified by the clerks and goes to the ballot. Comes to the legislature. Legislature then can choose to adopt the measure by majority vote, when we go into a regular session like what we've had the ability to do right now. If there's no action taking, the initiative would go on the next statewide general election and will have to receive 60% of the total votes cast to pass. Section 15 is old code. And then section 19 is where we're removing the legislative alternative. And then the effective date shall be the year after passage of SCR 527, which is the next bill I'm going to explain, which is our constitutional change we would have to make to allow the people to have a initiative measure change made in the statute. So I'll flow into SCR 527, which has similar provisions, amends the Constitution to allow the people to propose, amend, or repeal statutory new laws via an initiative measure. The initiative measure shall not be used to propose or amend PERS, modify the initiative process, propose or amend sections of the Constitution, or propose or amend laws related to abortion. The initiative measure, again, shall have one subject. The petition must be signed within a 12-month period. Total signatures equal to 10% of the qualified electors as of the date of the last presidential election, which is a little over 200,000 signatures. The signatures shall be proportionate, distributed over the congressional districts. So should we in 3 years and in maybe 10 years, should we lose a congressional seat and move down to 3 congressmen instead of 4, like we've had seen change before, it would proportionately change without us having to come back and go through this process again. If you do get excess signatures from a congressional district, those are not counted towards the total. You have to get a proportionate amount from each district. Like we talked before, the source of revenue has to be delineated. The target fund has to be provided. LBO shall provide an analysis. Sufficient petitions shall first be decided by the Secretary of State, subject to review by the Supreme Court, as we do now. Secretary of State will file a certified measure on the first day of a regular session. Again, like we talked about in the statutory change, it'll go through the process I explained before. The 60% rule that we mentioned before, no more than 2 initiative measures shall be on a single ballot. The measure will take effect 30 days after official declaration of the vote. And then some provisions on changing. The measure shall not be changed for 2 years unless the legislature determines an emergency affecting the peace, health, safety, or financial solvency of the state. In such a case, the change in that emergency situation will require 3/5 vote of each house to make that change. Legislature shall provide the manner for petitions, which is what we talked about in the other bill. And then the proposed measure, when it goes into our code, instead of saying as enacted by the legislature, it will be styled as saying it be enacted by the people of Mississippi, so that someone in the future would know that this came by that process. And then the proposed amendment shall read this. So this would be what was on the ballot. The proposed constitutional amendment provides that the people reserve to themselves a right to exercise the legislative power of the state to propose new laws, to amend or repeal existing laws by initiative measure, and to approve or reject the same in election independent of the legislature. So again, a long discussion on something we're all familiar with. again, I know we all have strong feelings about this. I've had fairly good feedback from different parties about what we're proposing here. I think we've made some changes that some people will find positive, some people will still have, some questions about. But with that, I'll open it to questions from the committee. Senator Blackwell.
Thank you, Mr. Chairman, and I certainly appreciate your work on this. I support it. The only question I have is just 10% of the registered voters, just seems like a low threshold.
This is the electorate of, so that actual number, to kind of give you the a number on that, 10% of the qualified electors at the time of the last presidential election, I believe is the line we have, which is 1.99, 1,991,502. I believe it would take 199,000 total signatures to place an initiative on the ballot. I think that's the provision that that everyone kind of puts the most attention on. I would consider it, I'd prefer, because I think we're going to have a lot of debate on the floor about that. I'll just go on record as saying I would consider it a friendly amendment should you decide through your research to want to raise that number. But I would propose it might be more appropriate to do that on the floor.
I appreciate that. We'll talk offline and see if we can't come to an agreement on a little
Yeah.
higher number.
Any other questions? Senator Blunt.
Thank you, Mr. Chairman. I would just ask you to consider a few things as we work through the process. I think this bill is a much better bill and more open bill than the bill that passed the House. With regard to Senator Blackwell's question, I would say that number is almost doubling the current requirement. And I think that's, I want to say the theory that the citizens are going to not know what they're doing and are going to be manipulated by outside interest and big money campaigns. That's a theory, but I would say we have 30 years of evidence to show how the people of Mississippi did with the initiative process that they used to have. And they voted for good things and voted against bad things. So, I mean, I think that fear is misplaced. So I would ask you to consider first a number that is closer to what we've had for 30 years and is based on, I think everybody in here would tell you the number of qualified electors is really not an accurate number in many counties. And so I'd ask you for a lower number, but whatever that number is, I think it ought to be based on votes, which is a hard number that we all can count on, and not number of registered voters in the counties, which is often inflated. I have some concerns about the 60% threshold. We're talking about general law here and not the Constitution, which I think is the way that I proposed it to it is a good idea. I would ask you to consider doing what we do here in the legislature and passing general law with 50% vote and passing revenue measures with the 60% vote, because we don't require a 60% threshold to pass general law in here. I have concerns about the subject matter requirement and mimicking this sort of unworkable, in my opinion, legislative rule about how you're going to pay for something. For example, if there was an initiative, to expand Medicaid under the terms that I think both houses are looking at, which is to pay for it with an assessment on providers. That two subject matters? Or would you have to say, in this example, the state is going to pay its 10% match for expanding Medicaid, but I've got to go find 10% somewhere else in the budget, which I think is what our rules require, because I know I can't offer an amendment to expand Medicaid and pay for it with a provider assessment, because that's a general law. And so if I wanted to do that on the floor in the form of amendment, I'd have to go find that money from some other budget and take it. And I think that doesn't make a bit of sense. I think what you need to show is how you're going to pay for it. I don't have a problem with that. But is having a assessment on providers and a Medicaid expansion, or having a fee on administering a medical marijuana program. I couldn't do that. I couldn't, because that's not taking money from another state agency budget to administer a medical marijuana program. So I think that's just something we need to think about. And finally, I would say, I personally don't have a problem with letting the people of Mississippi decide what subjects they want to use this process for. And I don't think they should be limited in any subject matter that they want to take up beyond what they've already had the ability to do. And so there's some new limits in here that I think are just, I think we ought to just let the people have their voice on what they want to deal with. So beyond that, I think it's a much better start than what the House presented to us, and I hope we can get it done this year. Thank you.
And I'll share just a couple of comments to, starting with the first point you made about the number of signatures. And when we first passed an initiative measure in 1914, I believe, the number of signatures required at that time was 7,500. That number has changed over time. And what I've come to find out is that with technology and other things where people can be made aware of things, it is easier to make people aware of things. And so while, 100 years ago, a very small number was, considered, I think now the ability to, reach people is greater. And so I think you can and you should achieve a greater threshold. I had a conversation with a lady last week, new to the Capitol, who had introduced a bill and was unaware of the process we go through here. So when I explained it to her, her head was spinning. She was looking around like, you have to pass it through this committee and then on the floor and let's go over all this. We have an arduous process to pass legislation in the state, I feel, for a reason, because there are good ideas and there are bad ideas, and because we're considering this legislatively, I think we need to give strong attention to the fact that, there will be good ideas and bad ideas that may be showing up on our ballot, and I definitely want to make sure that we have a threshold there that is reflective of the trends of communication of the day. The other thing that, well, I've lost track a little bit of the second point that you were making there, but I do think that because a number of these will be revenue based, that a consideration to having a higher threshold is where my 60% comes from. But I do appreciate that comment, and I will look and think a little bit on that. And then, and I've forgotten the last point that you kind of meant there. If you want to refresh me, you can. But as always, I do appreciate feedback, and as this moves along, as always, I will consider any and all questions that come up on it. So, with that, are there any other questions? So, seeing none, in front of you, we have the two items in block, 2770 and 527. Is there a motion? All in favor say aye. Any opposed? Okay, those will be reported. I appreciate your indulgence. We may have one more meeting next week, and possibly on Tuesday at an early time as well. I will keep you all informed of that. Is there a motion? Thank you.
Good meeting.
Thanks, sir.
Last two, both committee subs, is that what he said?
No.
Then just do pass.
Title
right?
sufficient do pass,
Just
yes.
do pass.
Yeah.
Okay.
I thought he said.
Yeah.
You should take them up and block.
Yeah.